right, well, it's 6:01, so we will get started. Thank you for joining me this evening to learn a little bit more about Medicare. I also will have this recorded, so if you wanted to watch it later, and if you have questions, I did unmute everyone. I will have a time for questions at the end, but feel free to mute your phone or your computer while I'm going through the presentation, and then I'll be happy to take questions. So let's get started. So what is Medicare? So Medicare is a national health insurance program for people over 65. It's administered by the Center for Medicare and Medicaid Services, but you enroll through Social Security, which I know is very confusing for people when they turn 65. So who's eligible? So everyone over the age of 65, including all US citizens, also legal residents who have lived in the US continuously for more than 5 years, and then you've probably known some people that have Social Security disability. Well, they are also able to join Medicare. So there's 4 main parts of Medicare. You have Part A, which is your hospital benefit. Part B is all of your doctors. Part C is a combination of A and B, and they call it a Medicare Advantage plan. And lastly is Part D, and that is your prescription drug coverage. So most clients that we work with have 2 tracks. One, you can go with Part A and B, along with D, which is that prescription drug coverage, and then you get a supplement plan, and that supplement covers what Medicare doesn't. The other option is a Medicare Advantage plan, and that's where like Johns Hopkins or trying to think what other hospitals around here, but you have one specialist in each area. So one cancer doctor that specializes in a specific type of cancer, or internist or whatnot. And they join together and create their own plan. So it has Part A, Part B, and also your prescription drug benefits, but they also add where you really can't go out of network. You stick with the doctors that are in that plan, like a Kaiser plan is similar to that. So how do you enroll in Medicare? So unless you're covered by an employer plan, you must enroll when you turn 65. So if you keep working, you can wait. And we'll talk more about that. But for most people, when they turn 65, they'll sign up for Medicare. So if you are taking Social Security at 65, which most of our retirees right now are actually delaying Social Security, but if you do take it at 65, they will enroll you for Part A and Part B right then. And if you don't enroll, if you're not taking Social Security, you need to enroll yourself, and it will start the first month that you turn 65, or the first of that month. So even if your birthday is July 31st, July 1st, the benefits will begin. So you enroll in Medicare through the Social Security Administration, and all of our clients at Hartford Financial Group, that's a service we now offer. So if you come in, I can meet with you and we log into Social Security together. I walk you through the process online for signing up, or you can make an appointment and visit Social Security yourself, but I just wanted to let you all know that is a service we offer here. So you have 3 months prior to turning 65 to sign up, the month you turn 65, or 3 months after. You really want to be in this first window with 3 months prior, and the Social Security Administration lately has been very delayed. So I've been really encouraging clients, if you know that you need to be on Medicare sooner than later, let's look at that 3 months before your birthday month. So who signs up for Part A during the initial enrollment period? So check with your benefits administrator at work, but even if you're still working, a lot of clients do still sign up for Part A because it's free. The main reason you would not want to do that is if you have an HSA account. If you have an HSA account at work, you are not allowed to contribute any more to that plan. So definitely talk to me or talk to your benefit administrator before you sign up for Part A. So who signs up for Part B during the initial enrollment period? So again, if you are not working, you would want to sign up at 65. If you're self-employed, If you're in an employer that will not let you stay past 65, a lot of times they say plans that have less than 20 people. But I know here we've had associates that are over 65 that stayed on our benefits, so it must be plan by plan basis. If you're on COBRA, that does not count as a qualification for not signing up for Medicare. So please do not continue Medicare past age 65. You need to sign up for, or do not continue COBRA, I'm sorry. You need to sign up for Medicare. Same if you're receiving retiree health benefits or employed by a company that has worse benefits than Medicare. It makes sense to just sign up for Medicare at that point. So who signs up for Part D? So I've talked to a lot of people. They're under the impression, well, hey, I don't have any prescriptions and I'm going on Medicare, but I don't want to pay for Part D because I'm not using it. Well, if you do not get Part D at that time, you can pay a penalty the rest of your life. And the plans are as cheap as like $7 a month. So it's not like it's a huge expense. So even if you're not on any prescription drugs when you turn 65, we need to get you set up with a Part D plan. And again, that's something we help with here at Hartford Financial Group. We go right on Medicare's website and sign up through them. And it's really easy and it takes about 20 minutes of your time. So let's talk about this special enrollment period. The initial enrollment period is everyone that signs up around their birthday at 65. But this special enrollment period is for people that are working to 66, 67, even I've had clients that are 70. They continue on their employer plan, and then they call me about 3 months before they're going to retire, then we sign up. Well, that's your special enrollment period. You have 8 months starting the month your group coverage ends to find a new plan. And when you do this, you can also get a Medigap plan at that time without answering any health questions. So a lot of the commercials are like, you sign up at 65 or you're gonna have all these penalties. Please remember, and if you want it in writing, I will get it to you from Medicare's website, but you do have this special enrollment period. So don't flip out if you're still working. So the best time to roll in Medicare is your initial or special enrollment period. They're your two main times, and you want to sign up before your current coverage ends. So the last time you can sign up, and you really do not want to sign up here, but this is your general enrollment period. This is open for everyone from January 1st to March 31st, and the coverage begins July 1st. The major issue with this is you will not automatically qualify for a Medigap policy, and they will ask 2 pages of health questions, your height, your weight, the whole 9 yards, and you are really taking a chance that you can't get a Medigap policy. So please do not go during the general enrollment period. If you're not sure, call me. So we'll go over the 3 main enrollment periods. Your initial, that's right around when you turn 65, 3 months prior, the 3 months after you turn 65. And then the special enrollment period is when you're still working and you can stay on that group plan, stay on it. If it's cheaper than Medicare, go for it. Then we'll get you squared away when you're ready to retire. And then lastly is that general enrollment period. And please do not go there unless you have to. So to sign up for Medicare, you just go on Social Security's website, and they have a My Social Security login with a username and password. You bring that in with you, and we can sign up together, or I could send you the instructions over email and you'll be able to sign up yourself. If you don't feel comfortable doing that, you can call Social Security and set up an appointment, but I will tell you, a lot of offices are not meeting in person. I think to go in person right now, you have to go in like Baltimore County, Baltimore City area. Abingdon is not taking it in person just yet. So how do I sign up for Medicare Part D? This is one of the easiest ones. Once you have your Medicare card with your Part A and your Part B date, we go on Medicare's website. We enter all of your prescription drugs that you take, the dosage and the amount that, you know, if you take 2 a day or 1 a day and all that good stuff. We enter it in. Then we also put your preferred pharmacies and it will come up with multiple plans to choose from and show you what you will be paying every year for prescription drug coverage. And again, if you're not taking any drugs, it is no big deal. We still use that same system. We just don't enter any prescription drugs. And then we see what the cheapest plan is. And if your prescription changes in next year, open enrollment is every year from October 10th to December 7th for Part D, that you can sign up for a new plan that'll start January 1. So I know there's a lot of dates. So again, feel free to email me with questions. So you do have out-of-pocket costs with Medicare. It's not completely free. Your Part B premium, you have to pay that, and I believe it's $192 this year. You have to pay that for your doctor's visits before they will cover anything. And but other than that, they literally cover the 20% that Medicare doesn't cover, depending on what plan you pick. So Part A is free, whether you or your spouse had over the 40 quarters paid into Social Security. Part B for the general population is $148.50 a month each. So with Medicare, there's no more husband and wife discount or anything like that. Everyone is an individual and pays as an individual. And then Part D, you pay for the prescription drug coverage, and that runs about $7 to usually $25 a month is the max I normally see for Part D. This is if your income is above $176,000 as a couple or $88,000 as an individual. And so they feel like, you know, you're making your fair share, you have to pay more. So as you can see on the rates on this side, it maxes out at $622 a month if someone's making, a couple is making over $750,000 a year. I haven't had anyone in that range in here yet, but I have had people in like this range. And like you can see, it went from the $148.50 with the increase of the Part D and everything, you're right around $368 for that. So again, you do have deductibles, but this slide upsets me because it doesn't tell you the whole truth. So Part A, yes, you do have a deductible of $1,484 per spell of illness, but your supplement pays that every time. So don't let that number creep you out. The Part B is $203. I don't know, I must have been on last year's numbers at $192. But Part B is a $203 deductible every year that when you go to your doctors, you pay the first $203 each year, and then everything else is covered by Medicare. Part D, the first $445 of your prescriptions you pay out of pocket, and then once you hit that deductible, then they start covering your prescriptions. I will say I have a lot of people that are on 8 or 10 different prescriptions. If they are generics, you're really not going to spend a lot of money. It's when you have the prescriptions that are like the tier 1s or whatnot that are newer, that don't have a generic, that's when it gets expensive. So again, your Part A hospital coinsurance, all of this is paid by the supplement. You're not paying this $371 a day or $742 a day for the days 91 to 150. All of that is covered by the supplement. Part B, it pays 80% of all of your doctor's visits, and that actually, Part B benefits include your diabetic like sticks and that, like testing your blood, falls under Part B. And Medicare pays 80%, your supplement's going to pay the 20% they don't. So you have a Part D coinsurance. We talked about this briefly, but there is that $445 deductible you need to meet before they cover anything. After that, you're paying 25% of the drug cost. So it's really not too bad unless you're on like a Trulicity or one of these high-end medications that they don't have a generic yet. So Medicare covers 100% of your first 60 days in the hospital. And then they also cover 80% of your medical service, your doctor's visits and all that good stuff. and then some of your preventative services like your flu shots and some of your screenings. Medicare does not cover long-term care. It does not cover care delivered outside of the US, dental and vision care, hearing aids, cosmetic surgery. The only acupuncture they will cover, which I learned because a client corrected me after my presentation last fall, but they will cover acupuncture for lower back pain only. Other than that, they don't cover it. And they don't cover anything that's over the Medicare approved amount. So there's definitely some limits, but for the most part, you're good. So deductibles and coinsurance amounts are covered by these Medigap policies or Medicare supplement policies. They cover that Part A deductible, the hospital cost after 60 days, the 20% of the doctor bills that Medicare doesn't cover, and some plans even cover charges that are above what Medicare covers. I'll show you that in a second. So Medigap policies, they're private health insurance for individuals. They're sold by private insurance companies, but they are regulated by the government. Your two main plans in Maryland are Plan G and Plan N. Plan G is running clients anywhere from $150 to $180 a month each. And what I like about Plan G is they were talking about Medicare only covering a certain amount for doctor's visits. So say your doctor charges $125 to see them, and Medicare says, well, we only pay $100. Well, Plan G will cover that excess charge of $25. They also cover the 20% that Medicare doesn't cover, and there's no copays. Now, Plan N covers most of what Plan G does, except it does not cover the excess charges and you have copays. So if you go to the doctors, it's a $25 copay. If you go to the hospital, it's a $50 copay. And both plans are very good, but that's the difference, and you're going to see that in the pricing structure for each. So now we're on to Medicare Advantage plans, and I will try not to tell you what I really think about them. No, I'm just kidding. So Medicare Advantage plans are just not my favorite because I feel like people are stuck. And unfortunately, I've had some family members that have had cancer and different health issues. And when you have a Medicare Advantage plan, there's no second opinions. You have to go to the people in that plan. So, if Johns Hopkins does have one, and if you like every doctor at Johns Hopkins, you might be okay, and you're going to save some money. Medicare Advantage plan can run from $50 to like $120 a month, but you are stuck in that plan, and you cannot go outside to see a specialist outside of their network. But they do sometimes have dental benefits. They do sometimes have vision benefits. And they will lump your Part A, B, and D, that prescription drug benefits, in one plan. And these are regulated by the government, and we can sign up for them during open enrollment as well, from October 10th to December 7th. So what can cause your healthcare budget to go up in the future? So I'll be honest with you, any insurance plan that you purchase, any supplement, it does go up over time. So I've been seeing the average of $2 to $3 a month increase for most of our clients from last year to this year and the previous year to this year. So just know that over time, it is not a set cost and it is going to increase. And then over time, the government keeps increasing the deductible. So I think when I started selling Medicare supplements, I thought the prescription plan was like $425, and now we're up to $445. And then the Part B deductible is up to that $201. So it's slowly creeping up each year. And then do remember, dental coverage, vision coverage, hearing, that is not covered by a supplement or by Medicare. So it can really add up if you need major dental work. And I've had clients ask me, yes, I can sell you a dental plan, but for what you get, I'm not a big fan of them. I'm happy to get the information to you, but I don't like to see people waste money. So if you contact your dentist and let them know that you'll no longer have dental coverage, sometimes they have their own plans built in. So planning for future healthcare costs, they do a study each year, and they're saying that most adults over 65 should plan for about $295,000 for healthcare costs and retirement. This is not including long-term care. And again, they're showing the average for men is about 130,000, women about 146,000. So this is really important that it's part of your long-term plan to think about these medical expenses. So remember, long-term care is not covered by Medicare or Medigap policies. They don't cover skilled nursing care after that 100-day time period, and they do not help with activities of daily living. So if you don't have assets in place to cover long-term care, or you don't have a long-term care policy, just know that can be very expensive. Right now, I think the next slide, sorry, I keep jumping ahead. I believe the average was between 80 and 100,000 a year right now for a nursing home. So that can add up very quickly. And you don't want to bleed your assets down to be able to have care. You want to have good care. So it's something to think about and talk to your advisor about a long-term care plan or looking into long-term care insurance. And again, it belabors long-term care because they want you to have a plan. They don't want you to burden your family and avoid spending down your assets to go on Medicaid. That's, you know, a Medicaid bed, that's any opening. So if you're in the state of Maryland and you need to go to a Medicaid bed, it might not be in Harford County. It could be in Baltimore City. It could be in Cumberland. It's wherever they have an opening. And as these baby boomers, you all know you're getting older, you want to make sure that you have the care you deserve. You worked your whole life very hard and you want to be able to enjoy your retirement. Just make sure you have a plan so that way you're not spending your last days in a terrible facility. So a couple of reminders: enroll in Medicare on time. You have your initial enrollment period and you have your special enrollment period. They're the two you really want. You want to shop carefully for the private insurance, and I'm happy to help you with that. Again, if you receive ads and you want to go that route, you know, that's fine too, but we're happy to help you here. And just plan over time, those healthcare costs are going to continue to increase and you just need to be prepared for them. Well, thank you guys so much. Does anyone have any questions?